Anemia. Anemia occurs when the body does not have enough healthy red blood cells, or when the amount of hemoglobin in the blood is low. The red blood cells in the blood carry oxygen throughout the body. A protein called hemoglobin allows the red blood cells to absorb and release oxygen. Without enough red blood cells or hemoglobin, the body doesn't get enough oxygen. Symptoms of anemia may then occur. Symptoms of anemia. Some people with anemia have no symptoms, but most people have symptoms that range from mild to severe. These can include tiredness or fatigue, weakness, pale skin, shortness of breath, dizziness or fainting, rapid heartbeat, trouble doing normal amounts of activity, and jaundice or yellowing of the eyes, skin, or mouth, and potentially dark urine. Causes of anemia. Anemia can occur when the body loses too much blood, does not make enough red blood cells, destroys the red blood cells at a faster rate than it can replace them, and does not make a normal amount of hemoglobin in the red blood cells. These problems can occur due to many reasons, including a condition that a person is born with, congenital or inherited. This includes sickle cell disease or thalassemia, heavy bleeding for any reason, including injury, surgery, childbirth, or even heavy menstrual periods. Being low in certain nutrients such as iron, folate, or vitamin B12. This may be due to poor diet. Also, a condition like celiac disease or Crohn's disease can cause poor absorption of the nutrients. And exposure to certain medications, such as those used for chemotherapy. There are different types of anemia. Your healthcare provider can tell you more about the type of anemia you have and what may have caused it. Diagnosing anemia. To diagnose anemia, blood tests are done. These tests can include complete blood cell count, or CBC. This test measures the number of the different types of cells in the blood. Blood smear. This test checks the size and shape of the blood cells. To perform the test, a drop of blood is viewed under a microscope. A stain is used to make the blood cells easier to see. Iron studies. These tests measure the amount of iron in the blood. Iron is needed to make hemoglobin in the red blood cells. Reticulocyte count. This test measures the number of new red blood cells being made by the bone marrow. And hemoglobin electrophoresis. This test checks for problems with the hemoglobin in red blood cells. Treating anemia. Treatment for anemia is based on the type of anemia, its cause, and the severity of your symptoms. Treatments may include diet changes. This involves increasing the amount of certain nutrients in your diet, such as iron or folate. Your healthcare provider may also prescribe nutrient supplements. Medications. Certain medications treat the cause of the anemia. Others help build new red blood cells or relieve symptoms. Blood transfusions. Replacing some of the blood can increase the number of healthy red blood cells in the body. And surgery. In some cases, surgery can be done to treat the underlying cause of anemia. If surgery is needed, your healthcare provider will explain why it must be done. He or she will also explain the procedure and outline the risks and benefits for you. Long-term concerns. People with certain types of anemia can expect a full recovery after treatment. Other types of anemia, especially those a person is born with, need to be managed for life. Your healthcare provider can tell you more. What we have learned. Anemia is caused when the body makes enough healthy red blood cells. True or false? The answer is false. Anemia happens when your body doesn't have enough healthy red blood cells, or when the amount of hemoglobin in your blood is low. Symptoms of anemia can include being tired, having a rapid heartbeat or shortness of breath. True or false? The answer is true. But some people with anemia have no symptoms. Treatments for anemia are based on the type of anemia and can range from diet changes, medications, and blood transfusions. True or false? The answer is true. And in some cases, you may need surgery to treat the underlying cause of anemia.